If your knee still won't straighten after having a knee replacement, do not ignore this. Not getting your knee to straighten after surgery is one of the biggest reasons people have difficulty with walking, they have difficulty with stairs, and they get to the point where they feel their recovery is stuck. It doesn't have to be this way. So why is extension so important? Because it allows the knee to actually lock in, which gives the muscles a break, improves the stability of your standing and walking. Without it, the quad never gets a solid foundation. And if the knee stays bent, the body starts to compensate. Everything has to adjust for that bent knee. Most people just chase after flexion, but honestly, extension is what will clean up and perfect and make it comfortable to walk. Flexion gets all the attention, but extension is what will give you your walk back. So the million-dollar question, why won't your knee straighten? It could be swelling. Even a little bit of swelling can make your knee feel blocked. Could be quad shutdown. So if the quad isn't firing, then it can't actively get the knee to go fully straight. It may be hamstring guarding, where the muscles behind the knee are just staying tight and protective. Sometimes it's pain and irritation. If the knee feels threatened, it's going to protect it. Sometimes it could be how you're spending your resting time. This is huge. People can sit with a pillow underneath their knee because it feels so comfortable, but then accidentally they are training the knee to be bent. Your knee will learn to adapt to the position that you are putting it in through most of your day. If this is exactly what you're struggling with, comment or message me the word straighten and I will send you my free extension protocol. So now let's talk about the things that you need to avoid. Number one, do not sit or lay for a long period of time with a pillow behind your knee. Yes, it feels comfortable, but is it good for your extension? No. Number two, forcing your knee down aggressively. People ask their partner to push down, their spouse, but forcing it could actually increase swelling and guarding. Number three, only working on bending. Yes, flexion matters, but extension is your foundation for walking. Number four, walking more on a bent knee. So walking more doesn't mean it's going to fix it. It can actually reinforce that bent knee. And number five, waiting too long. So there is no magic deadline where all hope is lost. However, extension is usually restored easier, earlier rather than later. What are we going to do to improve our extension? Number one, let's calm the knee down. If your knee is swollen and angry, it will not want to straighten. Before working on extension, reduce the irritation. Try elevating above heart height and use gentle movement to keep the circulation going. The next is a relaxed heel prop. You'll take a towel roll or a pillow, put it under your heel, and then just let your knee be unsupported and relaxed. Don't push down on it. This should feel like a strong stretch or pressure, not sharp pain. Next, after the knee has had a chance to gently relax into extension, you will tighten your thigh and push the back of your knee down to the surface. This will connect the passive extension to active control. You don't just need the knee to be pushed straight, you need the quad to control that straight knee position. So with a small roll under your knee, tighten your quad, lift your heels slightly, and slowly lower. After you've done the extension work, take a walk and notice, how does my knee feel when I'm walking? Is it getting straighter? Does my walking feel a little bit smoother? If you have sudden worsening of pain or calf pain, fever, your extension, no matter how consistent you are with working on it, is just not improving, then contact your surgeon or your physical therapist. If you are several weeks out and your knee is still not close to straight, don't just wait and see what happens and hope it fixes itself. This is one issue that if it's ignored too long, it can get very difficult to fix. I take this very seriously because it affects your quad strength, your walking, stairs, and your overall recovery. I keep a few virtual spots open every week for people that are struggling with range of motion issues. If that's you, message or comment straighten, and I will help you figure out what to do next.